Hello, I'm Hannah Storm. Did you know that 1 in 60 children, like me, will be born with a disfiguring hemangioma, a large port wine stain, or a prominent birthmark? Approximately 30% of these vascular abnormalities are visible at birth. The rest become visible 1 to 4 weeks later. In some cases, these hemangiomas and vascular birthmarks can be severely problematic, interfering with breathing, eating, seeing, hearing, even speaking. These vascular abnormalities require immediate, aggressive intervention. For these patients, the Vascular Birthmark Institute of New York at Roosevelt Hospital provides the most comprehensive care available in the world. Founded in 2004, the Institute and its team help hundreds of children every year, even those who come here after being misdiagnosed or deemed untreatable elsewhere. One such child is Luis Alonso Vilca. Luis Alonso came here from Peru for treatment of a severely disfiguring birthmark. His parents had exhausted their resources on unsuccessful procedures in South America, and the Institute was their last hope.
Originally, I received an email from a distressed mother in Peru. She had been to a number of doctors in Peru. Some of them did not know exactly what the problem was. Some of them told her there's nothing we can do. The mother somehow found out about our group, found out about the Birthmark Institute, and contacted us.
Before the surgeries, he feels like he was different because his face, it wasn't normal, and he always asks me why he has that mouth like different.
It became quite obvious they did not have the resources necessary to come from a country like Peru to an environment like the United States, where the cost of medicine is significantly higher.
One of the problems with Luis is that he has a very aggressive venous malformation. And the problem with this lesion is that it bleeds so profusely on contact that he can lose half of his circulating blood volume in a very short period of time.
To treat Luis and other children with vascular birthmarks, top doctors at the Institute use state-of-the-art technology, including 3D imaging, to evaluate their patients' options. They also assemble a multidisciplinary team of specialists to provide the best treatment for each patient.
We need the ability to have a group of very professional individuals, nurses of the highest level, technologists that are trained specifically to handle very sophisticated equipment. They're extremely expensive. It's a tremendous effort. Many of these kids cannot even pay, so we need to raise money to be able to take care of these kids.
Despite the disfiguring and sometimes life-threatening nature of vascular birthmarks, most insurance companies still classify the treatment of vascular birthmarks as elective cosmetic surgery. Many deny or delay benefits to children and their families like Luis's. The Vascular Birthmark Institute of New York advocates for greater public awareness and understanding of birthmarks that will lead to fairness in insurance coverage for these procedures. And part of their commitment to this cause is their determination to see that no patient is turned away.
By you helping us, the resources that you provide to us will have a tangible result. You're going to actually be able to see the difference that your dollars literally can make in the life of some of these children. It's more than cosmetics. It is the development of these children.
There's no question that this treatment makes a huge difference. In the recovery room, when I take the parents to see the child, this is the first time they've seen their child look normal. It's obviously very emotional, and very emotional for me as well. So I enjoy this because I'm giving, I'm helping, and I guess in a true sense this is what medicine's about. We're able to help and really see what we're doing in a very short period of time.
I would like to thank each of those people who help children like my son, because there are a lot of people like me who can't find that help in our country, and with their help we can travel to places like the United States, where we can find technology, a lot of experience in doctors, and everything.
Successful surgeries such as Luisa's are made possible by donations to the Institute from private individuals like you. Your donations help to underwrite hospitalization and follow-up care for infants, children, and adolescents who could not otherwise afford treatment. In order to keep costs on these cases to a minimum, you should know that surgeons' fees are waived and limits are placed on the fees of other medical staff. Your donations go directly to providing the greatest help in covering operating room charges, anesthesiologist fees, time spent in the recovery room, nights spent in the pediatric intensive care unit, and for parents, hospital housing.
Alonzo's done very, very well. He's really come a long way. It makes me feel very, very happy to see how far he's come. I think that the world will be a much brighter place for him.
But we may stop for a period of 3, 4, 5 years. Let the child go back to normal life, even with some changes. I asked them, has it made a difference? And the first thing was a smile in the child's face and the fact that he wants to go back to school. He wants to go back to relate again with his friends.
We are very grateful for making my son smile every day.
The Vascular Birthmark Institute of New York has already changed the lives of hundreds of children like Luis Alonzo. But with your help, we can do so much more. Doesn't every child deserve the chance for a healthier and happier future?